Hello guys, so today we shall be discussing regarding the muscles of your hand. Okay, so topic of discussion will be muscles of the hand. Okay, now in the muscles of the hand we have got basically five. We basically have got 5 groups of muscles. Okay, so all the muscles which I will be discussing today are called as the intrinsic muscles of the hand. Now in these muscles of the hand I shall be discussing completely 1, 2, 3, 4 as well as 5 groups of muscles. Okay, so what are these 5 groups of muscles? So first very important thing is that, so when I am putting my hand like this, you can see that there is an elevation over here, right? So this elevation which you can see here, this is called as a thenar elevation, and below that you can see another elevation here, right? And this elevation is located beneath this, the first elevation, right? So beneath the first elevation we have got a second elevation here. So this elevation is called hypothenar. So these group of muscles here, are called as thenar muscles, whereas these group of muscles over here are called as hypothenar muscles. So we have got 2 groups here. We have got thenar muscles, we have got hypothenar muscles. Okay. Now apart from that, we have also got some muscles. I will be telling you anyways all of these things, but for now I am just writing it as lumbricals. Okay, we have got some muscles called as lumbricals, and after that we have got muscles called palmar interossei, as well as we have got muscles called as dorsal interossei. Okay, we have got muscles called as dorsal interossei. So how many groups of muscles do we have, guys? We have got thenar, we have got hypothenar, right? We have got lumbricals, we have got palmar interossei, as well as we have got dorsal interossei. So these are the 5 groups of muscles which are located within your hand. Okay, now let us start with the thenar muscles. What are the thenar muscles? So first of all, thenar muscles are located here near your thumb. So what are the actions of the thumb, guys? The first thing, look here, this is called as flexion. Okay, this is called as a flexion of the thumb. Next, if I am moving my thumb away from all the remaining 4 fingers, so what is this action called as? It is moving away. This is called as abduction. And if I am moving my thumb towards all these 4 fingers, this is called as adduction. Okay, so this is abduction, this is adduction. And what is this? This is called as flexion. Okay, this is called as flexion. Next important thing is that with the help of the thumb, I am able to oppose each finger. I am able to count the fingers, right? I am able to count all my fingers like this, right? So this is called, this finger is going in opposite direction of each finger. So this action is called as opposition. Okay. So what are the functions? The first important function is that when I am moving my thumb away, this is called abduction, and the muscle is called as abductor. Abduction of what? Abduction of your thumb. So thumb in Latin you call it as pollicis, right? Pollicis. So this muscle is abductor pollicis. So these muscles are located in the intrinsic, these are the intrinsic muscles, they are located in the thenar eminence, right? So these muscles must be small. So that is why abductor pollicis brevis. Okay, let us look onto the second muscle. Second muscle is that I am able to flex my finger. So the muscle is flexor. Flexion of what? Of my little finger, of my thumb finger, which you also call it as pollicis. So flexor pollicis, and obviously this muscle also belongs to the thenar region. It means it must be small here. So flexor pollicis brevis. Third important thing is that if you can look here, I can count. You see, my thumb is going towards each finger. I can count all my fingers. So this action is called as opposition, and the muscle that is involved is opponens. Opposition of what? Pollicis. Again, opponens pollicis. And the final function, as I told you, so if I am taking my finger away from all these 4 fingers, I can also bring my thumb towards my 4 fingers, right? So this is called as adhesion or adduction. Okay, this is called as adduction. So the muscle is adductor pollicis. So these are the 4 muscles which are located in the thenar region. Now let us go on and discuss about the hypothenar region. Now in the hypothenar region, what are the muscles do we have in the hypothenar region? The first important thing, I can move my little finger away from all these four fingers. You see, this is called as abduction. I can bring my little finger back also. This is called as adduction. Okay, I can flex my little finger. This is called as flexion. And not only that, I can also do opposition function. I can also touch my thumb. My thumb is here. I can also touch my thumb like this. This is called opposition. Okay. So what are the actions again? So first important action is I am moving my little finger away. So this is called abduction. So the muscle is abductor, and little finger in Latin you call it as digiti minimi. As you call pollicis for the thumb finger in Latin, you call digiti minimi for the little finger in the Latin. Okay, abductor digiti minimi. Digiti minimi. Okay, right. Let us go on to the second. I can also flex. So this is flexor digiti minimi. Third important thing is that I can count. So this is called as opponens digiti minimi. And finally we have got the last muscle, that is called as palmaris brevis. Palmaris brevis. So these are the four muscles which are located in the hypothenar. Now when it comes to lumbricals, I will be discussing about each and everything later on, but I am just giving you a rough picture. When it comes to lumbricals, very important thing you need to know is that lumbricals are, why they are termed as lumbricals? Because lumbricals, they look like worms. I hope all of you have known this parasite by name 𝐒𝐧𝐼R's lumbricoids, right? So that is a worm actually. So these lumbricals also look like worms. That is why lumbricoid like muscles are called as lumbricals. Okay, and how many lumbricals do we have? We have got 4 lumbricals. And where are these lumbricals located? From my previous lectures, I have already told you, if you have studied the muscles of the forearm, we have got 4 tendons, I told you, right? So what are these 4 tendons? These are called as a flexor digitorum profundus tendons. Okay, flexor digitorum superficialis also we have got 4 tendons only. Okay, but I am talking about flexor digitorum profundus. Let us say there are 4 tendons of flexor digitorum profundus like this. Okay, attached to these tendons we have got these lumbrical muscles. Okay, lumbrical muscles are attached to flexor digitorum profundus tendons. Okay, keep that thing in mind. So how many tendons do we have? We have got 4 tendons. So how many lumbricals will be there? Obviously 4 lumbricals, right? So let us say we have got lumbrical 1, 2, 3 and 4. Okay. Now what do you mean by interossei? There are 2 interossei here, right? Palmar and dorsal interossei. What do you mean by interossei? Inter is in between. Ossea means bone. So in between the ossea, in between the bones, you have got these muscles. These are called as interossei. So palmar interossei means on the palmar side, in between the bones. Let us say here, between the first metacarpal and the second metacarpal, here you have got one muscle of palmar interossei. The second palmar interossei, the third palmar interossei, the fourth palmar interossei. So on the dorsal side also, the first palmar, second, third and fourth palmar interossei, dorsal interossei. Okay, so how many palmar interossei and how many dorsal interossei? 4. Okay, so 1, 2, 3, 4, 1, 2, 3, 4. We have got 4 muscles. So overall if you count, there will be 20 muscles. Okay, 20 muscles which we shall be discussing today. Clear? Now let us first of all look at the nerve supply and clear it off. Then we can go to the discussion of the muscles. Okay. So regarding the nerve supply, guys, one very important thing you need to know is that, look here, I am just highlighting few important things. So this is these 3 muscles and the first 2 lumbricals. Okay. Now all the muscles, all the intrinsic muscles of your hand, all of them are innervated by ulnar nerve except these yellow colored marked muscles. Okay. So what I am going to write is that all intrinsic muscles of hand are innervated by ulnar nerve. All the intrinsic muscles of the hand, they are innervated by which nerve? They are innervated by ulnar nerve. Okay, except what? Except what are these muscles? Abductor, pollicis, brevis. Okay, next we have got flexor, pollicis, brevis, right? Flexor, pollicis, brevis, and next we have got opponens, pollicis, OP, opponens, pollicis. Not only that, even lumbricals, we have got lumbrical number 1 and lumbrical number 2. So these muscles, except these 5 muscles, except these 5 muscles, remaining all the muscles, all the intrinsic muscles of the hand which we discussed, all of them are supplied by ulnar nerve. And what are these supplied by? These are supplied by median nerve. These are supplied by median nerve. Okay, these are supplied by median nerve. And remember one thing, one very important MCQ that has been asked again and again is that adductor pollicis is called as, right, adductor pollicis is called as the graveyard of ulnar nerve. Adductor pollicis is called as a graveyard of ulnar nerve. Now why this is called as a graveyard of ulnar nerve, I will tell you later on. Okay, why this is called as the graveyard of ulnar nerve, guys? Look here. Here, where is adductor pollicis? That is a thenar muscle. So it means it must be located here. Now where is your ulnar nerve? This is how your ulnar nerve will pass. Okay, so you see, this is how your ulnar nerve will pass. The ulnar nerve will enter into the palm, it will make a U-turn and finally end in the thenar region. Now what is this? Why is this ulnar nerve ending in the thenar region? Because ulnar nerve has to supply to one muscle in the thenar region. What is that? Adductor pollicis. So ulnar nerve is traveling all the way and finally ending in the adductor pollicis muscle. That is the reason why adductor pollicis is the graveyard for ulnar nerve. I mean, ulnar nerve finally ends within this adductor pollicis, so you call it as a graveyard of ulnar nerve. Okay, right. So now we have discussed regarding the nerve supply of the intrinsic muscles of hand. We have also discussed about the thenar muscles and its actions. We have discussed the hypothenar, its actions. Now we shall be focusing on the lumbricals. Okay, so now we shall be focusing on the lumbricals. So as I have already told you, if you want to remember, just remember it, that why these are called as lumbricals, because their ascar is lumbricoid like muscles. Okay, they are worm like muscles. So let me write a note here, they are worm like. They are worm like muscles, that is why they are called as lumbricals. Okay, next important thing is that whenever, okay, by the way, let me first of all draw these lumbricals. Okay, how many flexor digitorum profundus tendons? Again, remind me, guys, there are 4 tendons. So let us say there is one tendon here, right? This is a second tendon, this is a third tendon, and this is a fourth tendon. So there are 4 tendons of flexor digitorum profundus. Okay, now attached to these 4 tendons only we have got the lumbricals, I told you, right? Now look here. Here we have got one lumbrical muscle. This is one lumbrical. Here we have got a second lumbrical muscle. Okay, now look here. Here we have got a third lumbrical muscle. So this is a third lumbrical muscle. And next, here we have got a fourth lumbrical muscle. So if you can look here very clearly, guys, this is lumbrical number 1. This is lumbrical number 2. This is lumbrical number 3, and this is lumbrical number 4. Okay, now I know you are confusing because why the structures are like this. Look here. If you keenly look here, lumbrical 1 and lumbrical 2, both of them are only onto one side, which means both of them are unipennate. Unipennate. They have got only one penna. Whereas 3 and 4, lumbrical number 3 and lumbrical number 4, they are bipennate. So this is a thing you need to remember. Lumbrical 1 and 2 are unipennate, whereas lumbrical 3 and 4 are bipennate. Okay, they are called as bipennate muscles. And what is the nerve supply, guys? We have just talked about that. 1 and 2 are supplied by which nerve? Median nerve. If you can look at the picture above, see 1 and 2 I have highlighted here, right? So 1 and 2 are supplied by median nerve. But remaining all of them, the remaining 3, 4 and all of them are supplied by ulnar nerve. Okay, so 1 and 2 are supplied by median nerve. Median nerve. Whereas 3 and 4 are supplied by ulnar nerve. Ulnar nerve. Okay, and where are they attached? They are attached to the tendons. They are attached to tendons of flexor digitorum profundus. Flexor digitorum profundus. Now, if you look at what is the action of lumbricals. So, whenever I tell action of lumbricals, you just have to put your hand like this, right? So, this is an L shape, right? L for lumbrical. So, this is how you place. So, what is this? First important thing is that these are your individual metacarpals, right? So, there is a joint between metacarpals and phalanges, and this joint is called as metacarpophalangeal joints. Next important thing is that between the digits, between the distal, proximal and the middle, you have got two joints here. What are these two joints here? These two joints are called as interphalangeal joints because they are in between the phalanx, right? So, this is metacarpophalangeal, these are interphalangeal. Now, look here, whenever I tell action of lumbricals, you just have to put it, you just have to place your hand like this, which means, look here, am I flexing my, look at this joint here, look at the metacarpophalangeal joint, am I flexing it or am I extending it? So, this is called extension, this is called flexion, I am flexing my metacarpophalangeal joint. So, flexion of metacarpophalangeal joints and extension of interphalangeal joints is the main function of your lumbricals, okay. So, this is a very simple thing. So, when it comes to lumbricals, so what is the function? That is flexion of metacarpophalangeal joint, or simply call it as MCP joint, okay. And next we have got extension of interphalangeal joint, extension of interphalangeal joint. So, this is an important thing, you just have to keep it in your mind. Why am I telling you this? Because if lumbricals are not functioning, right, if lumbricals are not functioning, then this flexion extension things will not happen, that will reverse. So, there will be extension of MCP joint and flexion of IP joint. So, this will reverse completely, okay. So, we are done with the lumbricals. Now, let us move on to the interossei. We have got two types of interossei, I told you. One is the palmar interossei, another one is the dorsal interossei. So, now what we shall be doing is that we shall be discussing palmar interossei here, right, palmar interossei, and here we shall be discussing about dorsal interossei, okay. We shall be mainly focusing on palmar interossei, we shall be mainly focusing on dorsal interossei as well, okay. Now, I hope all of you know that these are your carpal bones, right. So, this is your first metacarpal, this is your second metacarpal, third, fourth and fifth. First metacarpal means the thumb, okay. Here also 1, 2, 3, 4, 5. Now, let us look at the palmar interossei. Now, palmar interossei, what did I tell you? Interossei, they arise from the bones, right, from the bones and in between the bones. What do I mean by that is, let us say palmar interossei are 4. So, here we have got one palmar interossei. There it is arising from the bone, right? It is originating from the first metacarpal, and where is it lying? It is lying between the first bone and the second bone, first metacarpal and the second metacarpal. So, interossei. Next, we have got second palmar interossei like this. Okay, we have got second palmar interossei. We have got a third palmar interossei like this, and we have got a fourth palmar interossei. So, how many palmar interossei do we have, guys? Let us count it down. This is 1, this is 2, this is 3 and this is 4. We have got 4 palmar interossei. Okay. Now, let us write some details about this. The first important detail I want to mention here is that these palmar interossei are unipinnate or bipinnate? Obviously, yes, these palmar interossei are all unipinnate. These palmar interossei are all unipinnate. And second important question which is repeatedly asked is that which metacarpal does not have any kind of palmar interossei? Metacarpal number 3 is devoid of palmar interossei. You see here, metacarpal number 3 is not having any kind of palmar interossei that are attached. So, third metacarpal is devoid of palmar interossei. It is devoid of palmar interossei. Now, let us switch on to the other side, that is regarding the dorsal interossei. Now, look at the dorsal interossei muscles and how are they arranged here. Look here. So, this is one dorsal interossei. This is one dorsal interossei. This is the second dorsal interossei. Okay. Now, this is the third dorsal interossei. And finally, this is the fourth dorsal interossei. So, how many dorsal interossei we have? Look here now. We have got 1, we have got 2, we have got 3 and we have got 4. We have got 4 dorsal interossei and 4 palmar interossei. So, now if you have to figure it out about the dorsal interossei, what are the first important point, guys? Whether it is unipinnate or bipinnate? Obviously, all the dorsal interossei are bipinnate. And which metacarpals do not have the dorsal interossei? Look here very carefully. Concentrate on the second metacarpal, guys. Concentrate on this second metacarpal. On the right side and on the left side, you have got dorsal interossei. Concentrate on the third one, third metacarpal also. On the right side of it, on the left side of it, we have got dorsal interossei number 2 and 3. Concentrate on the fourth. Even if you concentrate on the fourth, on the right and on the left, we have got 3 and 4 dorsal interossei. Concentrate on the fifth. Only on one side, only on the right side, let us say, we have got dorsal interossei, but on the left side there is no dorsal interossei. Even for the first metacarpal also, only on the left side we have got dorsal interossei, but on the right side we don't have any dorsal interossei. So, dorsal interossei are absent to which metacarpals? That is the first as well as the fifth. Keep this thing in mind. Okay. So, dorsal interossei are absent in the first as well as fifth metacarpal. Okay, first as well as fifth metacarpal. Now, all of you do these two questions, guys. These were repeated previously. All of the following muscles are bipinnate except, yeah, all the dorsal interossei are bipinnate. So, first dorsal interossei is bipinnate, fourth dorsal interossei is bipinnate, and look at the palmar interossei. Palmar interossei are unipinnate or bipinnate? Obviously, palmar interossei are unipinnate. Medial to lumbricals. So, let us look at the lumbricals, guys. Yeah, you see here medial 2. These are the medial. Which are the medial 2 lumbricals? 3 and 4 are the medial 2 lumbricals. 1 and 2 are the lateral, because look at the anatomical position. 1 and 2 are lateral, 3 and 4 are medial. So, 3 and 4 are bipinnate. 3 and 4 are bipinnate. So, the answer would be palmar interossei, because all the palmar interossei are unipinnate. Okay. Metacarpal devoid of attachment of palmar interossei, and we have already discussed that is third metacarpal. Okay. And second important thing you need to know here is that, guys, so there is an artery, right? So that artery is called as your radial artery. There is an artery called as radial artery, right? There is an artery called as radial artery, right? So this radial artery passes between the two heads of dorsal interossei in this way. Okay, so from where does this radial artery pass? Radial artery passes between the two heads of dorsal interossei and comes onto the palmar side. Okay, so keep this thing in mind. Even I'll mention it anyways. So radial artery passes in between two dorsal interossei. Okay, radial artery passes in between two dorsal interossei, or you can also call in between the two heads of dorsal interossei. Okay, so even that is the same. Next important thing is that, guys, this is a very important question. Now, what is that is, what are the actions of thumb, guys? Tell me. We have discussed many actions of thumb, right? So I am going to mention some of them. Okay, so I am going to mention some of these actions. So look here, the first action I told you, whatever it is, first or last, apposition is one of the action I told you, counting the fingers. So apposition is one of the action. Next, what did I tell you? If I can move my thumb towards my body, this is called as adduction function. And there is also one more thing, there is flexion, right? In the same way, there is also extension. You see, this is the level and I am extending my thumb. I am flexing my thumb is this one, extending my thumb is this one. So I can also extend my thumb. But the muscle which is responsible for the extension of the thumb, they are not located here. They are located on the back. That is the reason why whenever I am contracting that muscle, I can lift my thumb. Okay. So, these muscles which are causing extension of thumb, they come under the extensor group. Okay. So, that muscle is the extensor pollicis muscle. Okay. That is the extensor pollicis muscle which is present on the extensor side, on the posterior side. And as I have already told you, the entire extensors of your forearm, all of them are supplied by which nerve, guys? They are already supplied by radial nerve. So, these things I have talked when I was discussing the muscles of the forearm, right? So, there I have discussed that all the muscles of the posterior compartment of your forearm are innervated by what? Radial nerve. So, extension of your thumb is also done by radial nerve. So, there is one more action, that is extension. Okay, that is extension. Now, so let me write it down: opposition, adduction, extension. Opposition, adduction and extension. Now, opposition, right? Let us go back and look at the muscles of the thumb. Here, opposition is done by opponens pollicis, and opponens pollicis is supplied by which nerve, guys? Here, it is supplied by median nerve, not ulnar nerve, right? It is supplied by median nerve. So, I am writing it as opposition is done by median nerve. Median nerve. Look at adduction. Adduction is, where is this adduction? The fourth number, adductor pollicis, and that is supplied by which nerve? Not median nerve. This is ulnar nerve, right? So, that would be ulnar nerve. And extension, I already told you that it is radial nerve, right? What nerve? Radial nerve. So, if I wanted to, these are called as the long nerves of your upper limb. What are these three called as? These three are called as your long nerves of upper limb. These three are called as the long nerves of upper limb. Okay. So, if I wanted to check these three nerves in a patient, then I need not to do special tests in a patient. Rather, I can just tell the patient to move his thumb. If he is able to, I will look at if he is able to oppose all the fingers, is he able to count the fingers, right? Is he able to abduct it, or is he able to adduct it? Can the patient flex it? Can the patient extend the thumb? So, I will check the functions, the actions of the thumb. So, if he is able to do the actions of the thumb, whatever I ask him to do, it means all these three nerves are perfectly working. So, the question which was asked is, movement of which finger is used to test all long nerves of upper limb? Movement of which finger? So, obviously the answer would be movement of the thumb. Okay. So, movement of the thumb is responsible, it is used basically to check the actions of your upper limb. Now, let us go and discuss regarding the carpal tunnel, guys. This is very, very important.